I was experiencing nausea and vomiting. One particular day I had a lot of pain and I went to the emergency room and it was kind of stemmed from there. I live on the North Shore and I went to Lakeview and they sent me to UMC because of the doctors that they had there. The diagnosis at UMC was that I had some sort of carcinoma in the liver system. It had not been verified at that point in time, but that's how it presented. Since I had worked at East Jefferson, I requested that I have a cancer doctor here because I knew that their cancer center was one of the better ones. The referral was made for a physician in the rare cancer center. The final results of the biopsy was cholangiocarcinoma. There was an anticipation or a hope that the tumor could be removed surgically. Once those scans were done and I had seen the surgical oncologist, it was found that I really was not a candidate for surgery as to where the tumor is and the structures that it is close by. Dr. Morrison always has a plan B or a plan C, just in case. He always knows the next step. If something doesn't work, then we can do this or we can do that. Initially, the plan was for 2 types of chemotherapy and an immunotherapy drug. After only seeing him one or 2 times, he also broached the subject of a hepatic artery infusion pump, which delivers chemotherapy directly into the liver where the tumor is. And that's also when Dr. Limbach came into the picture. They coordinated this. This is something that has been used across the nation for a long time. They both put me at ease. I knew that they had dealt with them before, and they were very comfortable with it. You could tell they were very comfortable with it, just having discussions about it. And knowing that it's been used across the nation just hadn't happened here yet, and somebody had to be the first one, so why not? I'm hopefully feeling good about the future. Our hope is that the new medication, along with the infusion pump, will shrink the cancer to a point where it can be removed surgically, and Dr. Limbach can remove it and go from there. I couldn't be more pleased with the doctors that I have and the cancer center nurses. They're always on top of everything. Nothing stands out because it's all outstanding. They're responsive when I speak to them. They answer any questions that I have. They never make me feel rushed, and that's very important. And those are standout moments, but here it seems that that's the standard.